Damayanti is a 59-year-old lady with 4 adult children. Her dream is to see her youngest daughter, Himeshi, getting married in a beautiful, elegant, but traditional wedding. The highlight of this wedding would be when the groom would present his mother-in-law-to-be with a gift of 6 yards of silk as a token of appreciation for nurturing, for breastfeeding, and taking care of his bride, and for giving her daughter's hand in marriage to him. Now, Damayanti would carry this gift as a trophy on her head and would walk amongst the admiring looks of the guests at the wedding with tears down her eyes. But today, Damayanti's dream is a speck in far-off horizon. Instead of happy tears, she shed daily tears of sadness and fear. Damayanti was recently diagnosed with chronic kidney disease, the main risk factor being uncontrolled hypertension. She has to undergo daily dialysis, bi-weekly dialysis treatment and a plethora of investigations at a teaching hospital. All her treatment is free at the point of delivery, but with one catch. Himeshi, her youngest daughter, has to spend almost half of her salary she earns as a nurse in a private hospital on her mother's medical treatment. She spends money on her food because Damayanti is being treated as an outpatient. She has to spend on travel expenses to and back from the hospital. In addition, some medical investigations the hospital wants her to get done from outside and to buy certain medical equipment which are almost always out of stock in the hospital. Now, the term out-of-pocket healthcare expenditure is any kind of direct payment for health when receiving help made by an individual, patient, or a household. There are 3 components in this out-of-pocket healthcare expenditure. The first, direct medical cost, cost of medicines, investigations, and alternative care providers. Second, direct non-medical cost, cost on food, transport, and outside caregivers. Then there is indirect cost, which is cost of loss of employment, cost of loss of educational opportunities. WHO recommends that the out-of-pocket healthcare expenditure in a country should be around 20%. But in Sri Lanka, it's a staggeringly high 51%. When a household of a patient or an individual patient has to spend over 40% of their non-food subsistence expenditure on health, that would be called a catastrophic health expenditure. The household would go into impoverishment, that means below poverty line. The household will have to let go not just nice things in life like a wedding ceremony, but they will have to let go of basic necessities like education for the children, nutritious food for the family. In 2020, I conducted a study to ascertain the out-of-pocket healthcare expenditure per episode of hospitalization among patients treated in an orthopedic ward in a teaching hospital. The out-of-pocket expenditure among this population, patient population, per episode of hospitalization amounted to 9,901 rupees. Out of that, 30% was spent on radiological investigations because at that point of time, the X-ray machine in this hospital was not working. 20% was spent on travel expenses and 10% on food. 57% of these patients reported that they had to undergo debt to fund their episode of hospitalization. And out of this 27%, 23% had to pawn their jewelry at local pawnbrokers. Now, during the height of the COVID-19 pandemic, there was fear and concern that the healthcare system might be overwhelmed because of the increasing number of patients. But a group of stakeholders from the private sector and the public sector came together to create a system of integrated home-based management for asymptomatic or mildly symptomatic COVID-19 patients. This was an online platform where doctors could remotely monitor patients. And these doctors were not qualified doctors as yet because they were pre-interns, but they were working under the strict supervision guidance of healthcare specialists in family medicine. Patients were entered into the system when they qualified as asymptomatic or mildly symptomatic by the public health authorities, and also the patients could self-register if they consider themselves to be within that criteria. Further, these patients were also cared for during the post-COVID period, when the patients were monitored, counseled, and necessary referral done for post-COVID symptoms. This system managed to care for almost 700,000 COVID-19 patients until the system came to an end in 2022 April because the sponsorship came to an end. And it was also at a minuscule death rate of 0.0037%. You were basically very safe if you were cared by this system. So I was very fortunate to be part of this system. And I was amazed to see how a group of stakeholders from the private sector came and stood side by side with the public health authorities and how they were able to cater to the increasing number of COVID-19 patients, and also meanwhile they were able to bring down the out-of-pocket expenditure of these COVID-19 patients. Now WHO says that there would be a 18 million shortage of healthcare workers by 2030. Your average healthcare worker is overworked and underpaid. Would you ensure that your health is in right hands in such a person? I would like to ask you, isn't it time that all of you come forward to become your advocates for your own health, to become healthcare leaders, community healthcare ambassadors for the community and for our own health? So you would ask me, what would make me qualified enough to become a community healthcare ambassador, community healthcare leader? Let me tell you. You could be someone who did science for your A-levels. Or you could be someone who did science for even your O-levels. All of us did science for our O-levels. Or you could be a community leader. You could be a corporate leader. You could be even a young mother trying to find innovative solutions to feed nutritious food to your toddler. So all your expertise, your experience, your knowledge, your passion to seek new knowledge, your compassion would make you qualified enough to become a community healthcare ambassador, community healthcare leader who could stand side by side with your healthcare worker to ensure good health for all. Recently, I was again very fortunate enough to be part of another initiative called TB-Free Village. As you know, tuberculosis or TB is a highly infectious disease which spread through respiratory droplet infection from an infected individual to a non-infected individual. There is estimated as, according to WHO, about 800,000 TB patients in our community. That means these individuals are spreading the infection in the community, unknown to us. The reasons, among others, would be the stigma associated with tuberculosis, the fact that tuberculosis disproportionately affects individuals from low socioeconomic group who are living in congested surroundings and who are underfed, undernourished, and the lack of awareness about TB control facilities. Now, when you get your healthcare information, healthcare advice from a healthcare provider, he or she might appear distant and pedantic because he or she does not have much of an awareness about your lived experience. But when you get your healthcare information and advice from a community healthcare ambassador, someone from your own community, someone who knows your lived experience, you will be more open. In this initiative to create TB-free villages, community healthcare ambassadors, together with healthcare workers, went from door to door in a highly congested, marginalized community within the city limits. And I saw a transformation unraveling in front of my own eyes when the community was approached by these community healthcare ambassadors working side by side with healthcare workers. The community opened up. The stigma vanished. At least 5 individuals came forward claiming to having signs and symptoms suggestive of tuberculosis. And out of those individuals, 2 individuals were diagnosed to be positive of tuberculosis, and they were immediately initiated on treatment. If not for this initiative, these 2 individuals would be untreated in the community, endangering not just their own lives, but the lives of their close contacts, their friends and family. Now, how many of you in the audience know that there is a primary medical care institution within 3-kilometer radius of each and every one of your homes? Yes, that is that small hospital that you bypass to go and seek treatment in the larger hospitals in the city. And did you know that all of these healthcare institutions have an initiative called Healthy Lifestyle Clinics? Now the world, after the COVID-19, or even simultaneously, was in another epidemic, the non-communicable disease epidemic. Non-communicable diseases are diseases like complications of hypertension, diabetes, non-communicable hypertension and diabetes, strokes, heart attacks, cancer. These diseases are claiming more lives and creating more disability in the world than your regular communicable diseases like cholera, malaria, or even dengue. At these healthy lifestyle clinics, the healthcare workers would screen healthy individuals for risk factors for non-communicable diseases. Also, they would sit with you to create a plan for you to initiate on the journey towards reducing or eliminating these risk factors in your life. If you identified as of having risk factors, they would make the appropriate referrals. But the utilization rate of these healthy lifestyle clinics is at a dismal 20%. We, as healthcare ambassadors, healthcare leaders, should rally around the healthcare team in those small community hospitals, because those hospitals are our hospitals. And through standing side by side with those healthcare workers, we can contribute towards a non-communicable disease-free future where Damayanti will not have to undergo so much pain and suffering, so much. She will not have to suffer because of a high out-of-pocket healthcare expenditure. Sri Lanka has always been an innovative nation. This is a picture of an archaeological site in Mihintale, Anuradhapura. This is one of the oldest, if not oldest, hospital in the whole world. This hospital has evidence that this hospital has been catering not just to elite patients, but to ordinary patients, to even animals. So that innovative spirit, let's bring to our own lives. Let's stand side by side with our healthcare providers, our healthcare workers, to empower them, to empower us towards better health for all of us, so that Damayanti's dream would not be a dream far off in the horizon, but a dream that is within her arm's reach. I would like to think of our healthcare as a massive wheel, and I would like to think of all the individuals above the age of 14 years in Sri Lanka, that is approximately around 14.6 million, as cogs in that massive wheel. And we know if that wheel is to function at its maximum efficiency, each cog should function at its absolute precision. So each and every one of you cogs in that massive wheel which is our healthcare system, I would like to invite you to take the initiative to become that cog which function at its maximum precision, so that Damayanti's dream would be within her arm's reach and there would be a smile on Himeshi's face.